Guys, let's get straight to the point. Have you ever found yourself staring at the mirror, questioning why things down there don't always measure up to what you've seen in movies or online? Or maybe you've noticed your stream splitting off in unexpected ways when you're at the bathroom, making a mess and leaving you puzzled about what's going on inside. And what about those moments in the bedroom where everything starts off great, but then your mind kicks in with doubts and suddenly the spark just vanishes? If any of this sounds familiar, trust me, you're in good company. These are the kinds of quiet worries that millions of men deal with every day, but hardly anyone talks about them openly, even with their doctor. Today, we're changing that. I'm Dr. Elena Ramirez, a certified specialist in men's health with over half a decade of hands-on experience guiding guys just like you back to feeling strong, assured, and in charge of their lives. In this discussion, I'll guide you through why stress and overanalyzing can derail your intimate moments and how to regain that control. We'll uncover the real story behind those exaggerated images in entertainment and the behind-the-scenes methods some use to appear larger than life. Plus, we'll explore why your flow might divide sometimes and what that could signal about your inner workings and well-being. Stick around to the finish because I'll lay out a clear, everyday plan with routines, easy adjustments, and proven strategies that can boost your self-assurance and energy levels. Before we jump in, if this resonates, give that thumbs up a tap. It spreads the word to others who could use some honest guidance without judgment. Drop a note in the comments about your location. It's inspiring to see folks from everywhere joining this conversation. And if you're up for more no-nonsense, evidence-based tips on staying healthy, hit subscribe. Okay, let's roll. First off, let's address that nagging issue where your mind gets in the way during close encounters. A lot of fellows assume that if things don't stay firm, it means there's a deep-seated physical flaw that's here to stay. But that's far from the truth. For many younger guys especially, it's not about the body breaking down. It's the head playing tricks. This is what experts call mind-related firmness challenges, and it unfolds like this. The initial slip-up catches you off guard. Next time around, you're braced for it. Before long, the worry builds so much that your system goes into alert mode like you're facing a threat. Picture it. When your body senses danger, it sends resources to your arms, legs, and thoughts for quick action, not to the areas needed for relaxation and connection. Naturally, your setup down there gets the message that now's not the moment for fun, and things soften up. It's not a sign of inadequacy or a lifelong curse. It's just your thoughts hijacking the show. The good news, you can interrupt this pattern with smart steps. In my practice, I meet men of all ages who walk in convinced one-off night spells doom for their relationships. But studies tell a different story. Around 85 to 90% of these issues in men under 40 tie back to mental factors or subtle hints of heart-related concerns showing up early. Those tiny vessels in that region are like canaries in a coal mine. They react first to any circulation glitches before bigger problems emerge elsewhere. So, if you're in that age group and it's happening often, chatting with a professional makes sense, not because you're damaged, but to catch any whispers your body might be sending. If everything checks out physically, it's likely just the pressure talking, and that's something we can handle. Now, diving deeper into why this happens and how to fix it. Think of your body's response system as having two gears. One for chilling out and enjoying the moment, which is what allows blood to flow where it's needed for arousal, and another for gearing up to run or fight, which shuts down non-essentials like that. When doubts creep in, maybe you're concerned about lasting long enough or making your partner happy, that shifts you into high alert gear. The two can't run together, stress always wins out. This can hit hard emotionally, leading some guys to dodge closeness altogether, coming up with reasons to skip it, or feeling like they've lost their edge. But practically speaking, there are ways to turn it around. Start by easing off the expectations, shift the focus to simple touches, shared laughs, and building that bond without rushing to the main event. Over time, as you rebuild trust in yourself, bring back the full experience step by step. Sometimes a temporary helper, like a mild dose of a medication that supports blood flow, can act as a bridge while you retrain your mindset. These aren't about forcing anything, they just give you that extra reliability to break the cycle. And remember, real connection thrives on presence and care, not on putting on a show. Moving on to another big one, that habit of stacking yourself up against what you see in adult entertainment. It's something almost every guy has done at least once, glancing at those scenes and wondering why reality doesn't match. But let's clear the air. These aren't snapshots of everyday life, they're crafted productions designed to sell a fantasy. On average, studies from around the world peg the typical standing length at about 5.2 inches, with most men landing between 4 and 7 inches. So, what's the deal with those on-screen giants? It's all about picking outliers. Directors choose participants who are naturally on the larger side to fit the role. Then throw in clever filming, close-ups, specific positions, shadows, and cuts that amplify everything. Beyond that, some rely on tools like suction devices or stretchers to temporarily enhance appearance, or even quick fillers for added thickness. And for endurance, they might use aids similar to those for firmness issues to ensure reliability during long sessions. In extreme cases, surgical options exist, but those are more for restoring function after injury, not for vanity, and they come with serious considerations. Biologically, though, size isn't the key to satisfaction. It's about healthy circulation, being tuned into your partner, and that inner sureness. Getting hung up on comparisons can erode your self-worth over time, turning a non-issue into a mental block. Instead, think of it like comparing your casual weekend run to a professional marathon. The standards are worlds apart, so why hold yourself to them? To expand on this, consider how media shapes our views. From a young age, we're bombarded with idealized images, not just in entertainment, but in ads and social feeds, creating this false benchmark. But research backs that partners value emotional closeness, communication, and effort far more than measurements. In surveys, women and men alike report that confidence and attentiveness trump physical attributes every time. If you're feeling insecure, channel that energy into positives. Regular exercise boosts blood flow everywhere, including there, which can improve firmness and overall feel. Eating foods rich in nutrients, like nuts, leafy greens, and berries, supports vessel health, as advised by specialists in my field. Avoid the trap of unproven gadgets or pills promising miracles. Stick to what's evidence-based, like consistent stretching routines if you're curious, but only under guidance to avoid harm. Surgery. It's rarely worth the risks for cosmetic reasons. Complications can outweigh benefits. Focus on what you can control, building strength through fitness. Fostering open talks with your partner and letting go of those unrealistic yardsticks. You'll find that true fulfillment comes from within, not from matching a scripted ideal. Now let's talk about that frustrating bathroom scenario where your flow decides to go rogue, branching out in multiple directions and causing cleanup headaches. It's awkward, sure, but it's also a clue worth paying attention to. At its simplest, the tube that carries the flow can get a temporary clog from leftover fluids after release, like dried residue sticking at the end, which diverts the stream for a pee or two afterward. That's harmless and common. But if it's happening regularly, it might point to something like an overgrown inner gland, which is a non-cancerous swelling that squeezes the passage, or even scaring that tightens things up. Emotionally, guys often brush it off as just getting older, but ignoring it can lead to bigger discomforts down the line. Practically, if you spot a weaker push, delays in starting, leftover drips, or multiple nighttime trips, that's your cue to investigate. A quick tips, try handling it seated, which relaxes everything and can make the process smoother. It's a norm in many places and reduces splashback. Staying well hydrated helps keep things flowing evenly too. Delving further, that inner gland, often called the prostate, plays a big role here. As men age, It can enlarge naturally, affecting about half of us by 50 and more later on. Studies show this benign growth, known as BPH, links to hormone shifts and inflammation, leading to those urinary quirks. But it's not inevitable doom. Lifestyle plays a part. Specialists like me recommend incorporating anti-inflammatory foods. Think tomatoes for their lycopene, which research links to better gland health. Fatty fish like salmon for omega-3s that ease swelling, and cruciferous veggies such as broccoli to support detox. Avoid excessive caffeine or alcohol, which can irritate the system. Exercise, especially pelvic floor strengthening, like Kegels, where you squeeze as if holding back flow for a few seconds, repeat daily, can improve control. If symptoms linger, a checkup can rule out issues and offer options like medications that relax muscles or shrink the gland. Minimally invasive procedures exist for stubborn cases, but most respond to simple changes. Tracking patterns in a journal. Note frequency, strength, any discomfort helps your doctor pinpoint causes quickly. Putting it all together, here's how to make real shifts. For those mind-blocked moments, start with a basic health screen to confirm no underlying physical tweaks needed, blood work for hormones, heart checks. Then, practice mindfulness, deep breathing before intimacy to stay in chill mode. Therapy sessions, even online, can unpack those anxiety loops effectively. As a bridge, low-strength flow supporters prescribed by your doc can rebuild confidence without dependency. For comparison worries, ditch the screens that fuel doubts. Limit exposure and remind yourself of real stats. Invest in overall wellness like cardio for circulation, weight training for testosterone boosts, and a diet packed with zinc, rich foods like oysters or seeds, which studies show aid reproductive health. If exploring enhancers, opt for doctor-approved traction methods for gradual, safe gains, but skip risky ops. On the flow front, hydrate with at least 8 glasses daily, empty completely each time, and monitor for changes. For gland support, consider natural aids backed by trials, extracts from saw palmetto to curb growth, African tree bark for flow improvement, green tea for antioxidants, and stinging nettle to reduce irritation. I've got a reliable blend linked below if you're interested. Always check with your provider first. But let's pause and get real. If you've dealt with fading firmness, size doubts, or erratic streams, know this: you're not flawed or diminished. These are everyday hurdles for so many, signals that your system needs a little TLC, not proof of failure. Vitality doesn't fade with years, it's about smart choices. Enhancing blood flow through walks or swims, easing stress with hobbies, nurturing your gland with wholesome eats. These stack up to renewed ease and poise. Your worth isn't in metrics or flawless function, it's in showing up for yourself and those you care about with genuineness. So, take this as your nudge. Share in the comments one small step you're committing to this week for better health. Maybe it's adding more veggies, trying seated relief, or chatting openly with a partner. Let's build each other up. Your story might inspire someone else. Thanks for tuning in. Catch you next time with more empowering insights. Stay strong. To keep the momentum, let's expand on why these issues interconnect and how addressing one can uplift the others. Take circulation. It's the thread running through all three. Healthy blood vessels mean reliable arousal, natural fullness without artificial boosts, and smooth, unobstructed flows. Research from heart associations highlights that what's good for your ticker is golden for down below. Aim for 150 minutes of moderate activity weekly, like brisk strolls or cycling. Pair that with a plate full of colors, berries for vessel protection, nuts for healthy fats, whole grains for steady energy. Specialists advise limiting processed stuff and sugars, which inflame everything, including that gland. For mental side, journaling worries before bed can clear the slate, preventing them from invading intimate times. Apps for guided relaxation exist, backed by psych studies showing reduced anxiety in weeks. Consider real-life examples I've seen. A 35-year-old came in panicked after a few failed attempts, convinced it was the end. Tests showed perfect health. It was pure nerves from job stress. We started with breathing exercises. Inhale 4 counts, hold 4, exhale 4, and a short med course. Within months, he reported back with grins, saying it transformed not just the bedroom, but his whole outlook. Another guy, 45, obsessed with size after years of media influence. We talked facts, shifted focus to partner feedbacks, which was glowing on effort, not inches. And he began yoga for body awareness. No more comparisons, just appreciation. For flows, a 50-something with splits and nights up multiple times found relief in herbal support and cutting evening drinks. Simple tweaks, massive wins. Science underscores this adaptability. Neuroplasticity means your brain rewires with practice. Repeated positive experiences overwrite fear loops. Hormonally, consistent exercise elevates testosterone, enhancing drive and function. For the gland, meta-analysis of over 20 studies saw palmetto's role in easing symptoms comparably to meds with fewer side effects. Pygium from African plum improves flow by 25% in trials. Green tea's catechins fight oxidation, while nettle inhibits enzymes that spur growth. Combine them for synergy. Start low, monitor. Emotionally, owning these talks lifts burdens. Societies worldwide are shifting. Men's groups online share stories, normalizing help seeking. Partners often appreciate vulnerability. It deepens bonds. If solo, self-compassion exercises. Affirm daily strengths. Build resilience. Professionally, urologists like me use tools like ultrasounds for gland checks, flow tests for accuracy, ensuring tailored plans. Prevention-wise, annual check-ups post 40 catch early signs. Sleep 7 hours nightly. Poor rest spikes stress hormones, worsening everything. Hydration flushes systems. Dehydration thickens residues, causing splits. Mindful eating. Pomegranate for nitric oxide boost, aiding vessels. Watermelon for citrulline, a natural enhancer. Avoid smoking. It constricts vessels dramatically. In partnerships, communicate. Hey, let's take it slow and enjoy. Reduces pressure. Explore non-penetrative fun. Variety keeps things fresh. For singles, self-exploration builds familiarity, easing future anxieties. Ultimately, this is about empowerment. You've got the tools, knowledge, habits, support. Implement gradually. Week 1, track hydration and add walks. Week 2, try relaxation before bed. Build momentum, results compound. You're capable, resilient. Embrace the journey, vitality awaits. Expanding further on dietary advice from a urologist's perspective, focus on anti-inflammatory choices. Tomatoes, cooked for better absorption, provide lycopene that studies link to 30% lower gland issues risk. Broccoli and cauliflower contain sulforaphane, detoxing compounds. Salmon or mackerel twice weekly supply, omega-3s reducing swelling per Harvard reviews. Zinc from pumpkin seeds supports hormone balance. Deficiency ties to firmness dips. Vitamin D from sun or fortified foods aids overall function. Low levels correlate with challenges in large cohorts. For beverages, green tea daily, its EGCG inhibits unwanted cell growth. Limit red meat, excess associates with higher risks, opt for lean or plant-based. Berries, antioxidants protect vessels. A sample day, breakfast oats with berries and nuts, lunch salad with tomatoes, greens, fish, dinner veggies, lean protein. Snacks, yogurt with seeds. This fuels without overwhelming. On supplements, beyond the blend, consider standalone if needed. But whole foods first. Supplements enhance, not replace. Consult for interactions. Mentally cognitive behavioral techniques reframe thoughts. Challenge, I must perform perfectly, with connection matters most. Apps like Headspace guide this. Physically, pelvic exercises, 10 squeezes thrice daily. Strengthens support, improves control. For flows, if persistent, alpha blockers relax muscles. Minimally invasive heat therapies shrink overgrowth effectively.